Hi, this is Dr. Yoon Han Kim, and I'm a functional medicine and integrative medicine physician, and I'm an expert in clinical use of LDN. So today, I wanted to talk about one of my favorite topics in low dose naltrexone, which is has many names. In old days, we used to call it reflex sympathetic dystrophy, and for some reason, I really like that name, but they've decided to upgrade the name to complex regional pain syndrome. And I don't really agree with the name because I don't think it's a regional affair. I think it's coming from CNS. So the classical patients with the old reflex sympathetic dystrophy or complex regional pain syndrome may have or may not have, but the commonality is that it's an extremity pain. And what usually happens is that the pain um, has other features. It may have color changes, it may have heat, and oftentimes what starts in one area may spread, may go to the other side. It might go up to, um, if it's lower limb, it may go to upper limb at some point. So it's one of the most difficult pains to treat. Yet, using integrative functional medicine and low dose naltrexone, especially with neuroanatomical approach to pain, it's actually quite simple and reliable way of treating it. So LDN works through multiple mechanisms, including enhancing the endorphin production, but I don't think that's the mechanism because that if that was the case, we wouldn't get the dramatic pain relief that we see. The dramatic pain relief that we get to see, I think, is something to do with the inhibition of microglia or glial cells in the nervous system. And glial cells, when activated, become super pro-inflammatory. And what LDN does is that it allows our body to remain anti-inflammatory state, especially our nervous system, because when the phenomenon starts, I think that the nervous system gets stimulated, and it tries to overcome it. When it can't, it embraces it, it accepts it, and the along with this, the neuroanatomic approach to pain that I have developed is very effective in stopping this. The unfortunate part of it is that the neuroanatomic approach to pain has to be done in person. So LDN is, I just love LDN because you can get it almost anywhere. And if there's not a compounding pharmacy, there are instructions available in internet how to do the dilution yourself. Because the local laws are very tricky, physician may not be able to give instructions on those things. But it's just a matter of science experiment. You just look up how do I do 1 to 10 dilution, how do I do 1 to 100 dilution, and how do I do 1 to 1000 dilution. And I feel very grateful because before I became a physician, I was a chemist, a biochemist. So my skills in diluting and whatnot, that's actually, we used to do that almost every day in the lab. So anyway, if you find this to be useful, please share with other people. Please give me a like, subscribe to the channel, and ring the bell so that when I record more, you will get notified. Thank you.